and I'm pleased to get a chance to do it with you guys again. Bear with me, obviously we've had some audio visual issues, so when I switch from Mac to PC, some of the pictures don't show up, and, but still, hopefully you'll get the general concepts. My talk for today, I know some other people have come in and talked to you a little bit about heart disease and other things, but my particular talk for today is high blood pressure or hypertension. And listen, this is meant to be very, very interactive. I'm a pretty relaxed, laid-back guy, so if you guys have questions as we go along, please don't hesitate to raise your hands and stuff, and hopefully we'll have some fun. So just by show of hands, again, I want this to be as interactive as possible. Who here has a family member with a heart problem? Okay. Who here has a family member with pressure or high blood pressure? All right. So right now you can see here that what I'm going to talk about, which is high blood pressure, is a really, really significant problem. It affects all of us. Ultimately, will affect a majority of us in the room, most likely, and also certainly has affected your parents, your aunts, uncles, grandparents, etc. So this is something that we really should pay attention to, not only for your health, but for the health of your loved ones and people around you. Another question here: what is the leading cause of death in the world? All right. So by show of hands, who says it's cancer? All right. Who says it's cardiovascular disease? All right, that's give me. My colleagues before me have schooled you guys very, very well. The reality is when I ask this question to other people, whether it be people your age or significantly older, or quite even frankly, other healthcare professionals, many of them say cancer. Because cancer gets a lot of publicity. You hear about breast cancer, you hear about prostate cancer, you hear about all sorts of cancer screening, et cetera, et cetera, et cetera. And certainly those are important things, but let me give you some of the facts. These are some of the statistics on cardiovascular disease. And cardiovascular disease is any disease that affects not only the heart, but the blood vessels throughout the body. So it's a wide scope of things. And that includes high blood pressure, that includes heart disease, that includes stroke, which we'll talk on here in a little bit. But you can see here, reading the top line, cardiovascular diseases are the leading cause of death in the world. The leading cause of death in the world. The World Health Organization estimates in 2005, and it always delays a few years, but the last estimate was in 2005, that 17.5 million people died of cardiovascular disease. That's nearly a third of all the people that died that year died of some form of cardiovascular disease. So again, this is not a trivial disease. It's the number one cause of death and disability in the U.S. with an estimated cost in 2010, just last year, of $503.2 billion. So now you wonder why we're having such a hard time in the economy. The issues are there's a lot of health problems, cardiovascular disease being a critical one, and if we can attack this, perhaps we can right the country in the right direction. Just to give you perspective, cancer is almost half of that, $228 billion. So again, clearly this is a big disease burden and problem. The slide over here on the left, the slide over here on the left is a busy slide, but what I want to point out is the bars on the left-hand side, the red, the blue, and the yellow bars, all are what compose cardiovascular disease. And as you can see, cancer, which is the light bar, really pales in comparison to cardiovascular disease. And this is something that's really, really remarkable when you break it down by age. And people who are 20 to 30 or 20 to 40, about somewhere around 12% of people have cardiovascular disease. But as soon as you hit the age of 40, which I have the benefit of doing next week, you are 40% of my cohort will have some form of cardiovascular disease. By the time you hit 60, this is your parents and grandparents, almost 3/4 of them, 75%, will have some form of cardiovascular disease. Again, these are staggering numbers. The thought that 75% of people between the ages of 60 and 80 are walking around with some form of cardiovascular disease is really remarkable. This is an outline of what I hope to cover today. And again, as we go along, if there are any questions or anything comes up, please don't hesitate to stop me. We're going to talk about high blood pressure or hypertension. We're first going to define what blood pressure is. We're going to talk about the organ systems. I'm going to ask you guys what organ systems you think may be involved in regulating blood pressure. Give you a definition of hypertension, which is essentially high blood pressure. But what do those numbers mean? Talk about some of the risk factors, some of which I'm sure you guys have covered before, some of which you know before, for the development of high blood pressure or hypertension, the causes of high blood pressure or hypertension, the effects and why it's important that we get blood pressure under control, who it affects most, there's epidemiology and things, some striking numbers to share with you, and then ultimately the treatment and management of how we control it. Lastly, if we have time, and last year we did have plenty of time, is being a black physician scientist, I would love if you guys have any questions to ask me about being a minority in medicine and how I became to where I am now. I'm happy to share with that and any insight that I can. And then lastly, if we have some time at the end, we can have a little fun question and answer session and kind of a quiz on some of the stuff we covered. So to start off, I need a volunteer. All right, I'll take you. Slide this over. Right there, it's in the chair. Don't die. We're going to take a blood pressure. All right? No, you can just roll it up for me, please. Who knows how to take a blood pressure? You guys learned any of that yet? You seen it done?
Yes.
All right, so first of all, I will tell you that the majority of times when you guys go to the doctor, they don't do it right. And so this is a really important key. Everybody knows when you go to the doctor, they pull out that little white sheet and you sit up on the table with your feet dangling like that, and before you know it, they slap the cuff on you and they're taking blood pressure, right? The reality is in order to get a good blood pressure, you need to come in the room, you need to sit down, feet planted on the table, and really have about 5 minutes or 10 minutes to acclimate. Now, you may be a little bit nervous, so you haven't had that time yet. But the reality is it's really important to take a good, accurate blood pressure. The other thing is, does the size of this cuff matter? Yes, it does. So you want a cuff that fits properly, and the details of it we don't need to go into. But if the cuff is too small, it's going to raise the blood pressure. If the cuff is too big, so if you take a little pediatric cuff and put it on a really big guy like you, you're going to get an inaccurate reading, all right? You take one of the really big cuffs and put it on somebody smaller like you, it's going to be a smaller reading. So it's really important that we get the right size cuff. These are all important, okay? So I'm going to slap the cuff on nice and tight. I feel for the pulse, and I put my stethoscope right over the pulse, okay? And then I blow up the cuff, okay? It's going to get tight.
What do we find out she had like really high blood pressure?
That was not really.
Perfect. 120 over 75. So I blow up the cuff all the way up, really high, because you don't want to miss that high point. Many times people only blow the cuff up. You want to blow the cuff up to as high as 200 and let your patient know that they're going to feel something. Thank you. And then you can bring the cuff down nice and slowly, okay, a few millimeters per second. And then you listen for that first sound. That first sound is that top number, which we call systolic blood pressure, and we'll talk about what that means. And then you keep drawing it down until you get to until you lose that sound. That's the diastolic pressure. You guys may have covered some of this before, and we'll cover it again here today. Thank you for volunteering there. All right, so this is my first slide where the pictures didn't show up too well, but we'll manage. The circulatory system. Everybody knows what the circulatory system is, right? Hopefully you guys have covered this before. But on the left, I had a picture of a body showing all the blood vessels, the arteries and the veins, and the blood body. What the importance of the circulatory system is essentially cells in the body need oxygen and food to survive. Essentially, we need to feed the cells in our body. And oxygen and nutrients are carried to all parts of the body through the blood. And the circulatory system composes the veins and the arteries that essentially carry this blood and bring the oxygen and nutrients to the cells in your body. The heart pumps the blood out of its chambers through the blood vessels. I believe earlier on, I think on Monday or Tuesday, you guys had a lecture about the cardiac cycle and all the chambers of the heart. And essentially, it says the blood vessels carry that fresh blood from the heart to the rest of the organs, okay? So this is just kind of a broad overview of what is the circulatory system. So blood pressure. Blood pressure is the force of blood as it presses against the walls of the arteries, like the pressure of water in a garden hose. And I'm just going to bring up, so that I can at least see what the pictures are supposed to look like. 2 seconds here. So let me ask you guys this then. So, and that top number is the systolic blood pressure. Who can tell me what systole means? Anybody? All right, right there.
When the heart is actually like the push, the beat.
Right. So when the heart is actually squeezing, and diastole when the heart is relaxing. So you get two numbers. And what blood pressure essentially is it says there, and I had a picture that kind of showed a vessel, but essentially it's what happens when blood is pumped through the vessels and the force on the wall. So if you think of a garden hose, all right, without any water in the garden hose, the hose is nice and floppy, but when you push water in there, that water puts pressure on the walls. That is what you're feeling. That is what is called the blood pressure. A normal blood pressure is less than 120/80, and we'll get into more details of that as we go along. So everybody check your pulse. Everybody know how to check your pulse?
Yeah.
Right, you can either do it here or up there, right? And what do you feel? You feel something tapping against your fingers? Well, that's essentially your blood pressure that you're feeling. During systole, when the heart is contracting, you feel the bounce up against your finger. And during diastole, you lose it, okay? So this is really, quite frankly, a poor man's version of checking the blood pressure with the blood pressure cuff. In fact, when patients are or people are really sick, what we call out in the field or in the hospital, or even in the hospital or out when somebody's found down or something like that, the first thing we do is feel for a pulse. If you have a pulse, then odds are you have what we call perfusing rhythm. Your blood pressure is good enough that you can get enough blood to many of your vital organs. But if you don't have a pulse, then that suggests you're not in a perfusing heart rhythm, you're not generating enough force to perfuse, and that's when we frequently initiate CPR. Yes?
When somebody's down and you're rushing, like if somebody was coming through asthma, everybody's rushing so they can save the patient.
Yep.
Isn't it hard to find their pulse?
It can be.
So busy around you.
That's a very good question, and I won't lie to you. When it is a rush, and it very oftentimes is like what you see on TV with bunches of people running around, it can be very hard. But that's when you relax, take a deep breath, and try to find it. There are common places where the arteries are bigger, where you can feel the pulse better. So certainly if it's emergency, I'm not going for this little small artery here in my wrist, right? I'm either going for the neck, or there's arteries that are right here, really big arteries that run right in your groin area, that you can just feel right there. And then if you don't feel pulse, then frequently when somebody's very sick, we say we don't